So, my topic is healthcare substance abuse. When you think of someone who abuses drugs and alcohol, who do you picture? Picture them in your head for a moment. Now, picture a nurse who is highly intoxicated off of painkillers who is about to take care of your loved one. Or a surgeon who is about to go into a 12-hour surgery with the smell of alcohol on his breath. Those aren't the typical healthcare professionals that you think of who would abuse drugs or alcohol, but addiction does not discriminate, and this happens to everyone. Now let's talk about how this may happen. Workplace stressors, job dissatisfaction, and job burnout are one of the leading causes due to increasing geriatric population, so older people, and increasing life expectancy. The life expectancy of 2018 was 78 years old. I have a quote from Bettina, 2006. Burnout as a type of prolonged response to chronic job-related stressors has a special significance in the healthcare where staff experience both physiological, emotional, and physical stress. Other reasons can be because you're surrounded by death and illness, bad management, regardless of benefits or income that you're making. Now let's talk about how this could happen in the workplace. Medical professionals have easier access to controlled substances, and or they could show up intoxicated. Stealing has become increasingly harder due to technology such as the Pyxis Med Station. It's a station that hands out pills and medications to patients, but it has username, passwords, and barcode scanners so they know who's going in and out of the drawers. But nurses and professionals still figure out how to do it. Nurses might siphon out of vials, medication bags, steal narcotic waste. So when the patient gets discharged, if they have waste that's supposed to be thrown out, they steal that. Or they can document that they gave the medication to the patient when they took it themselves, they pocketed it. Doctors might illegally write themselves prescriptions. Realization of substance use disorder either by a colleague or with the individual themselves. They need to realize that this is a problem. Realizing when a colleague may be abusing drugs, they're sluggish, tired, jumpy, irritated, not just demonstrating normal work ethic. Their scrubs are all dirty, or they're just not well kept. This reminds me of the show Nurse Jackie that aired from 2009 to 2015, directed by Liz Brixis. Jackie was a drug-addicted ER nurse who worked in a very busy hospital in New York. The show depicts how she balances life, work, and her addiction, which she doesn't balance it very well. She gets herself into a lot of trouble in all three aspects. But she does state how the drugs make her feel like she's on top of her game, because when she goes a couple days without taking them, because she built a tolerance, you could start seeing withdrawal symptoms. So her coworkers start to notice, or her husband starts to notice when she's withdrawing. And she's a very good nurse, so when she is withdrawing, she's not on her A game. Medical professionals are usually the caretakers and problem solvers themselves, so seeking help may be difficult for them to become a patient themselves, but they need to realize that they're putting others in harm and their career on the line. In conclusion, substance abuse affects different demographics. Even if this is accidentally, addiction can occur and interfere with patients' health. Patients put enormous trust into their healthcare providers and deserve to have confidence in the type of care that they're receiving. With possible evidence of being high or under the influence at a healthcare facility in a court of law, nurses or providers can be held to imprisonment, supervised release, along with losing their career or their licensure in certain states. And I put together a little board. I'm going to move closer. So this is a little pie chart or stat wheel. 23 million people stated that they needed help with addiction. 2.3 million went and got it, and then 19.5 million didn't do anything about it. The workplace related substance abuse stats, 62% said they, sorry, I'm trying to get in the frame. 62% said that they were depressed. 50% said they had alcohol use disorder. 32% said they had prescription drug issues, and then 29% said they had recreational drug issues. And then this last one over here states healthcare workers that will abuse drugs or alcohol at some point in their career. That's 10 to 15%. 55% of doctors were surveyed. 69% said that they misused narcotic prescriptions. Doctors surveyed were being monitored by the state physician healthcare program for substance use related impairment. And that's all. Thanks for listening.